This presentation will cover the key technical skills that radiographers need to excel in medical imaging. From understanding the equipment to ensuring patient safety, we will explore the essential competencies for the effective practice in this field. Today we will discuss several crucial topics, including the types of medical imaging equipment, parameters that affect quality, techniques for positioning and preparing patients, methods for image evaluation, and the importance of safety and regulatory compliance. Familiarity with various medical imaging equipment is vital for radiographers. Each type of machine has unique functionalities and applications, which are essential to be mastered by the radiographer in practicing imaging technique. Medical imaging equipment is designed to look at different aspects of the interface of energy with tissue to give us an answer about the patient's anatomy, physiology, and condition. X-ray machines are commonly used for imaging bones and certain tissues. Radiographers must understand how to operate these machines effectively, including adjusting settings for optimal imaging quality. Computed tomography scanners, or CT scanners, provide detailed cross-sectional images of the body in 2D, 3D, and 4D. Radiographers should be proficient in using these machines, including understanding of the geometry of the imaging, slice thickness, and scanning protocols to achieve the best images. MRI machines use powerful magnets and radio waves to produce detailed images of soft tissues. Here we see an MRI scanner, and we also see a pulse sequence. The pulse sequence is how we actually interface energy with tissue to create data for image collection. It is crucial for radiographers to know how to operate these machines safely and understand safety protocols due to the strong magnetic fields associated with MRI. Today we have many types of medical imaging modalities available to capture images for the radiologist. Understanding the image quality parameters for each of the modalities is essential for producing diagnostic images. Radiographers must be knowledgeable about the factors that affect image clarity and the overall quality of the medical image. All medical images display different contrast and resolutions. Resolution refers to the ability to distinguish between two separate objects in an image, while contrast deals with the difference in brightness between structures. Both are critical for accurate diagnosis. Noise refers to the amount of data that we have captured to create an image. If we have enough data, we get clarity. If we have too little data, we end up with not enough data to create the image. As we can see in the top image above, it says, "Can you read this?" This is the exact same as the one above, which I cannot read. Anyway, image noise can obscure details while artifacts can mimic or obscure pathology. Radiographers must learn to identify these issues and to ensure high-quality imaging and accurate interpretation. Proper exposure settings are vital for producing quality images, while minimizing radiation when we use ionizing radiation, and maximizing the other energies that we use with different modalities such as MRI and ultrasound. Understanding the energies and controlling the energies that are produced by the different imaging modalities is done through technique selection. Medical imaging technologists must master techniques that enhance patient comfort and image quality. Effective patient positioning and preparation are crucial for obtaining clear and accurate images. Radiographers should be skilled in various patient positioning techniques tailored for different imaging modalities to ensure optimal positioning for diagnostic imaging. Ensuring patient comfort while immobilizing them for imaging is essential. The term immobilization is not used. It is actually a positioning aid that we're having to apply to keep the position for the patient free of motion. Radiographers must use appropriate methods to reduce movement and keep the anxiety during the procedure low for the patient being imaged. Each imaging modality has specific preparation requirements. Radiographers must be familiar with the preparation of patients to adequately obtain images. They need to enhance the safety and quality of the imaging process, whether it's CT, MRI, ultrasound, or X-ray. Radiographers must develop skills in evaluating and analyzing the images they capture. They must be able to identify any issues and ensure that diagnostic images meet minimum quality standards. Medical imaging technologists or radiographers should accurately assess the clarity and detail in the images that they capture to determine their diagnostic quality. This is critical for effective patient care. Being able to identify common errors and artifacts in imaging is crucial for medical imaging technologists. This skill helps in troubleshooting and ensuring that high-quality images are obtained. Prior to or after the image is obtained, which is called post-processing, radiographers can utilize various software tools for enhancing the image. Understanding how to effectively use these tools can significantly improve image quality and diagnostic capabilities. Safety and regulatory compliance are paramount in medical imaging. Medical imaging technologists must adhere to guidelines that ensure patient safety and the integrity of the imaging practice. More than simply looking at radiation safety for X-ray, we need to look at all aspects of the equipment and positioning and guarantee that our patient is safe during the examination. When using ionizing radiation, radiation safety protocols are essential to protect both patients and staff from unnecessary exposure. Radiographers must be diligent in following the protocols and making sure that exposures are correct. Medical imaging technologists, radiographers, need to be familiar with the regulatory standards governing their medical imaging practice. This knowledge ensures compliance and promotes safety within the imaging environment that they work. Ethics plays a vital role in medical imaging. I have many presentations on ethics on my channel. Radiographers must navigate ethical dilemmas while ensuring patient care and confidentiality. In conclusion, mastering essential technical skills is crucial for medical imaging technologists or radiographers to ensure high-quality imaging. They must understand the equipment they are using, focusing on the imaging quality, being skilled at preparing patients effectively, have the ability to evaluate the images they capture effectively, and adhere to safety standards. Radiographers can deliver excellent patient care. Again, this is Mark Struthers, and thank you for your time and attention. Please subscribe to my channel so that we can create more medical imaging presentations for your viewing.